Consider adrenaline, a much bandied word in modern science. Medical students are taught its effects early in their clinical training. It is a hormone or chemical messenger which is released at strategic nerve endings. In popular parlance, it prepares the body for fight or flight. This response, together with such function as nervous reflexes, tissue repair, and the immune system, forms part of the overall defenses of the body. Adrenaline is produced whenever an individual feels threatened or insecure for any reason, real or imagined, physical, intellectual, or emotional. The physical effects of adrenaline on the body are wide-ranging. The rate and depth of breathing is increased to keep the blood well supplied with oxygen. Sugar is mobilized so that energy is readily available. The heart is stimulated so that blood pressure is raised and the pulse rate increased to keep both mind and body supplied with oxygen and sugar. The flow of blood to the muscles is increased, making them ready for action and more responsive to nervous stimuli. Even the palms sweat to improve grip. To ensure sufficient use of resources, blood is diverted away from the skin and intestines, resulting in pallor, dryness of the mouth, suppression of appetite, often causing nausea, even vomiting and diarrhea. Adrenaline also changes the character of the sweat, giving it a nasty smell. This is possibly a primeval mechanism to silently warn others of danger. Nowadays, it gives chemists and drugstores a profitable line in deodorants. But it is not only the body that is affected. Emotionally, there is a feeling of apprehension, anxiety, or panic fear. Many people regard this as excitement. However, being tinged with apprehension, it is different from the excitement produced by passing an exam, for example, or an orgasmic opportunity. Intellectually, the mind is preoccupied by management of the immediate situation. In severe cases, the intellect is paralyzed, so that people act without thinking, as when one leaps aside to avoid an accident. All these effects can be replicated by giving a patient a subcutaneous dose of adrenaline for asthma or an allergic reaction. Thinking about this over the ensuing years, what struck me was the similarity between the effects of adrenaline and the psychosomatic symptoms presenting in the consulting room, such as palpitations, indigestion, loose bowels, together with anxiety and depression. Since adrenaline affected both the body and the mind, I started viewing it as a psychosomatic hormone, and psychosomatic symptoms a result of adrenaline intoxication. It would be a number of years before it became apparent that there were two other psychosomatic hormones, opiate and cannabis, occurring naturally in the body, which normally use the receptors in the nervous system, which are exploited by heroin addicts and cannabis smokers. The response to a threat can vary in severity from acute to chronic. If the threat is sudden and severe, the heart can be so overstimulated that people die of fright. The muscle can go into spasm so that people become paralyzed by fear or rooted to the spot. The bladder and bowels can evacuate spontaneously. Pregnant women can have a miscarriage. But an individual who feels chronically insecure is likely to be chronically under the influence of adrenaline. This is likely to cause a chronic increase in blood sugar, for example, and possibly lies at the root of diabetes. Likewise, chronically raised blood pressure may lie at the root of hypertension and heart disease. Chronic tension in the muscles is likely to cause aches and pains. The coordination of movements is impaired, so that movements become clumsy. Furthermore, the bone ends will be chronically pressed together so that the joints cannot lubricate themselves properly. This is likely to increase wear and tear and eventually cause osteoarthritis. If there is chronic adrenal intoxication arising from chronic insecurity, the effect can be visualized as chronically poisoning the body, just as chronic alcoholism poisons the body. Over time, it is possible that other pathological changes may be caused, just as chronic alcoholism eventually causes cirrhosis of the liver. The possible effect of this chronic poisoning on the metabolism of cholesterol, for example, or on immunity, or on the function of individual organs such as the heart, or on fertility, pregnancy and labour, or on genetic mutation and cancer, is therefore of fundamental importance. In fact, poisoning by the compounds associated with a chronic sense of insecurity is a possible common denominator of diverse disorders in which so-called stress has been implicated. In fact, I wondered whether, in the final analysis, all illnesses were caused by chronic insecurity. In the consulting room, it was, and still is, an apocryphal adage that the first principle of treatment is reassurance. Reassurance makes an individual feel more secure, thus neutralizing the effects of adrenaline. But I had noticed that when patients feel better, their personalities change. People have two distinct personalities. One is appropriate when an individual feels insecure, and the other when an individual feels safe. Consider these two personalities more closely. When it feels threatened, the intellect becomes focused on the immediate situation and self-preservation. But if the intellect is thus preoccupied, it cannot readily acquire new knowledge or contemplate the wider world, the interests of others, and the mysteries of the universe. The mind becomes narrowly focused on self and the immediate situation, which it seeks to control. Some of the adjectives which describe such a personality are withdrawn, selfish, mean, greedy, distrustful, dictatorial, cold-hearted, hostile, fearful, and so forth. Other adjectives are devious, manipulative, and dishonest. Chronically defensive personalities can become obsessed by sedative activities which make them feel better. They thus readily become habituated to sex, drink, drugs, and food. The personality of a person who feels safe and secure is non-defensive. Aware that the world will always be bigger than people, the personality knows its place in the scheme of things, relaxes into it, and accepts its fate. Adjectives which describe such a personality are kind, generous, warm, trusting, friendly, outgoing, amusing, sympathetic, and so forth. They are generally cool, calm, and collected, and good company. But the personality that the outside world sees is usually a mixture of the two, depending on individual circumstances, character, education, knowledge, the company kept, and general understanding of the world. But what caused chronic insecurity was the next question demanding clarification. Bye.